Hey guys, welcome back to the channel. If you're into natural remedies, you've probably heard about the amazing benefits of ginger. From boosting digestion to fighting inflammation and even helping with nausea, ginger is often seen as a miracle root. But here's the thing, ginger isn't for everyone. That's right. While it may be great for some people, if you have certain health conditions, ginger could actually be dangerous. Today, we're going to break down 9 health conditions where ginger could do more harm than good. Let's dive right in. First up, let's talk about bleeding disorders. Now, ginger is often praised for its ability to improve circulation and thin the blood. While that sounds like a good thing for many, it can be dangerous for people with bleeding disorders like hemophilia or von Willebrand disease. If your blood doesn't clot well, ginger could make the problem worse. What's more, if you're on blood-thinning medications like warfarin, also known as Coumadin, aspirin, or even ibuprofen, consuming too much ginger could increase your risk of internal bleeding or bruising. You might even experience excessive bleeding from minor cuts or wounds. And here's something a lot of people don't think about. If you're planning on having surgery, even a simple one like a dental procedure, you should avoid ginger at least 2 weeks before. Ginger's blood-thinning effects could lead to complications during surgery or make recovery more difficult. If you have a bleeding disorder or are taking blood thinners, ginger could be dangerous. Always talk to your doctor before consuming large amounts of ginger or ginger supplements. Okay, let's move on to something a lot of people overlook: gallbladder health. Your gallbladder stores bile, which helps digest fats. But if you have gallstones, ginger can be a problem. Ginger stimulates the production of bile, which can cause your gallbladder to overwork. This can lead to more pain, discomfort, and even potentially more gallstone attacks. If you already suffer from gallbladder issues, you might experience sharp pains, especially after eating fatty foods or consuming a lot of ginger. That's because the extra bile production can cause the gallstones to block the bile ducts, which is extremely painful and may even require surgery. If you've ever had gallstones or gallbladder issues, be careful with how much ginger you consume. Stick to small amounts, and as always, check in with your healthcare provider to see what's safe for you. This next one might surprise you. If you've been diagnosed with low blood pressure, also known as hypotension, ginger could actually make things worse. Ginger is known to lower blood pressure because it helps with blood circulation and relaxes blood vessels. While that's great if you have high blood pressure, it's not so great if you already struggle with keeping your blood pressure up. For people with low blood pressure, consuming a lot of ginger could cause symptoms like dizziness, fainting, and blurred vision. If your blood pressure drops too low, you might even experience shock or extreme fatigue. And if you're on medications for high blood pressure, combining ginger with your meds could cause your blood pressure to drop to dangerously low levels. So be extra cautious if you're taking antihypertensive drugs like beta blockers or ACE inhibitors. If you have low blood pressure, it's best to consume ginger in moderation and keep a close eye on how your body reacts. And of course, always talk to your doctor before adding ginger to your diet. If you have diabetes, this is super important for you. Ginger has been shown to lower blood sugar levels. While that sounds like a good thing for diabetics, it can be dangerous if you're already taking insulin or other glucose-lowering medications like metformin. Combining ginger with these meds could lead to hypoglycemia. That's when your blood sugar levels drop too low, which can be life-threatening if not treated promptly. Symptoms of hypoglycemia include things like sweating, confusion, shakiness, and even loss of consciousness. So if you're taking medications to control your blood sugar, make sure you're keeping track of your levels. Ginger can definitely help with blood sugar control, but it's a fine line between just right and too low. If you have diabetes, consult your doctor before adding ginger to your daily routine. You might need to adjust your medication to prevent your blood sugar from dropping too much. If you find this video helpful and informative, please support the Healthy Pantry channel by leaving your comment below, liking this video, and subscribing for more daily health and nutrition tips. Pregnant mamas, listen up. Ginger is commonly recommended to help with morning sickness during the first trimester, and that's totally fine in small doses. But here's where you need to be cautious. If you consume too much ginger, especially in the later stages of pregnancy, it could lead to preterm labor. Ginger is known to stimulate the muscles of the uterus, which can be helpful during labor but not so great when you're still in the second or third trimester. Excessive consumption could cause contractions or even trigger miscarriage in some cases. Also, if you have a history of miscarriages or are considered a high-risk pregnancy, it's especially important to talk to your OBGYN before consuming ginger. Most doctors recommend sticking to about 1 gram of ginger per day during pregnancy and avoiding ginger supplements unless advised otherwise by a healthcare professional. If you've got GERD or acid reflux, ginger might not be as friendly as you think. While ginger is often touted as a natural remedy for digestion, for some people, it can actually make things worse. Ginger has a spicy kick to it, which can irritate the esophagus and trigger heartburn or worsen acid reflux symptoms. If you notice that you get a burning sensation in your chest after consuming ginger, you might want to cut back or avoid it altogether. For those with chronic acid reflux, ginger can aggravate the condition, causing discomfort, pain, and even difficulty swallowing. If you love ginger but have GERD, try consuming smaller amounts and see how your body reacts. Sometimes, moderation is key. Heart patients, this one's for you. If you have any kind of heart condition, especially if you're on medications like beta blockers or anticoagulants, ginger might interfere with your treatment. Ginger is a natural vasodilator, meaning it helps to widen blood vessels and improve circulation. But this effect can lower blood pressure too much for those on heart medications, which can lead to complications. Ginger can also increase your heart rate in some cases, which might not be ideal if you have arrhythmia or other heart rhythm issues. Not only that, but because ginger is a natural blood thinner, it could interact with your heart medications and put you at a higher risk for heart attacks or stroke. If you have a heart condition, it's crucial to speak to your cardiologist before consuming ginger regularly or taking ginger supplements. Have you ever heard the saying, "Too much of a good thing can be bad"? Well, that's true for ginger, especially if you suffer from stomach ulcers or inflammatory bowel disease, IBD, like Crohn's disease or ulcerative colitis. While ginger is a fantastic anti-inflammatory agent, it can also irritate the stomach lining when consumed in large amounts. If you have stomach ulcers, ginger could make the symptoms worse by causing burning or pain in the stomach. Similarly, for people with IBD, ginger might aggravate symptoms like diarrhea, cramps, and inflammation. If you have a history of ulcers or IBD, start with small amounts of ginger and see how your body reacts. If you notice any worsening symptoms, it's time to cut back and talk to a healthcare professional. Lastly, did you know that some people are actually allergic to ginger? It's not super common, but it can happen. If you've never had ginger before and suddenly experience symptoms like hives, itching, swelling, or difficulty breathing after consuming it, you might be having an allergic reaction. In extreme cases, this can lead to anaphylaxis, which is a life-threatening allergic reaction that requires immediate medical attention. So if you're new to ginger, or you've noticed these symptoms after consuming it, make sure to stop immediately and see a doctor. So there you have it, folks. While ginger is an incredible superfood for many people, it's important to know when it could be working against you. Always consult with your healthcare provider before making any major changes to your diet, especially when it comes to natural remedies like ginger. If you found this video helpful, be sure to like, subscribe, and share with anyone who could benefit from this information. And don't forget to hit that notification bell so you never miss another health tip. Thank you for joining us here at the Healthy Pantry. We hope you found the information valuable and inspiring. Remember, your health is a journey, and we are here to guide you every step of the way. Thank you for watching, and we will see you in the next video.